Bismillahirrahmanirrahim and Assalamualaikum warahmatullahi wabarakatuh. I bid to Dr. Azwan and all my fellow friends. So today, our group 2, will present to you our case that we attend from SK Indra Mahkota for Low Vision Clinic. So, our patient is 12 years old, a male and a Malay, and a student at SK Indra Mahkota. So, based on the first visit on 26 February 2020, this patient was diagnosed with both eye congenital corneal opacity. So, from the preliminary exam that was been done in the first visit, this patient is noted that have good independency for grooming, eating, and mobility. His study performance is also good. He likes to create sentences and reads. Patient learn in normal classes. And patient also has a good social environment. He only had a restricted body movement due to his short body stature and short limbs. And as the family history, his father and his younger sibling also have the same condition. So, this patient has been referred to the low vision clinic for further assessment and suggestion of magnifier in its management. So, to sum up, in the second visit, it aims to test and suggest on which low vision aids is suitable for this patient.
Assalamualaikum warahmatullahi wabarakatuh. So basically, I will explain on objective of these cases. So basically, on these cases, the first visit is 26th of February 2020. When during this visit, the visual acuity that we can get from the distance is 1/60 habitual, and also the near got and 10 at 3 centimeters. So basically, the more problem that from this first visit, we can see that the vision probably at the distant and also near having a problem, which that distant VA is quite worse, and also the near VA is need use a near working distance just 3 centimeters, so very close to the object or reading material. The other test from entrance during this first visit cannot be done as certain issues. Okay, next we proceed to the second visit. So second visit is on 11 March of 2020. It's more on referred by to the low vision clinic for vision testing that that was tested by binocularly with a habitual. We can get the near N12 at 3 cm. That means that is more worse compared to the previous one, where the first visit is at N10 at 3 cm. Now N12 at the same working distance, which are 3 cm. And then the low vision aid that have been tested during this one, because we know that we want to cater the more problem of the patients of near vision. So basically, we are testing any visual aids that we can possibility during this visit. So basically, we choose the first one is a spectacle magnifier, CCTV or Pico, and also standard magnifier, and also illuminated handheld magnification. So basically, this detail of will be explained later by my colleagues. Okay, that's all from me. Thank you.
Okay, Bismillahirrahmanirrahim. Okay, for the first LV8 that we try on this patient is a spectacle magnifier in order to assist the patient in reading. So the spectacle magnifier that we brought is just a trial frame, and we use the trial lens sets to increase the power. So we start with +8 diopter on both eye, and patient managed to read N10 at 12 cm with difficulty, as patient had eccentric viewing. So we try to increase the power to +12, and patient managed to read more small letters of NX at 8 cm. However, once again, the vision is better. However, spectacle magnifier is not suitable, as patient is not comfortable with it, as he has to search for the words. Thoroughly using his eccentric viewing. Okay, for the next LV8 that we try on this patient is Pico CCTV. So using Pico CCTV, we noticed that the patient can read up to N5 at 10 centimeter. However, the reading performance is a bit low and slow. As for the record, patient already have Pico and handheld magnifier, and patient, however, is not used to it, and the teacher claimed that the reading performance is also slow using the Pico device.
The next low vision aids that has been tested to this patient is the stand magnifier. Okay, using 3 times of magnification, his vision improves to N10 at 8 cm, which this shows there is a little bit improvement compared to habitual VA. However, this patient is not comfortable with the stand magnifier because he has a short stature. So we proceed to the next low vision aids, which is the illuminated handheld magnifier. With the magnification of 4 times and power of 16 diopter, the VA improves to the N8 at 4 cm. Next, my colleagues will explain more in the discussion part about how we manage this patient.
Bismillahirrahmanirrahim. For the part of plan and management, we actually prescribe this patient with illuminated handheld magnifier with magnification of about 4 times, lens diameter is about 25 mm, power with 16 diopter, and the VA for this patient at near is N8 at 4 cm. Okay, basically the reason why we give this illuminated handheld magnifier to this patient as he felt more comfortable and it is more suitable than the spectacle magnifier. Okay, because patient will tend to surge forward, which is what we call eccentric viewing. Moreover, it will give a brighter illumination to this patient when he reads later. Okay, and then the magnifier can can be held at any distance that the patient comfort with. Okay, and lastly, handheld magnifier works well with patient with the eccentric viewing.
Okay, before that, firstly, my name is Alif Rahimati Alias, and we're going to continue the presentation with discussion of this case. Okay, so the discussion. The patient diagnosis is both eye corneal opacity, which is based on the previous visit, and the corneal opacity is a disorder of the cornea, because first we're going to know what is the function of the cornea, because the cornea allows light to pass through the eye to focus on the retina, so the image will become focused if it falls on the retina. But in the corneal opacity, the cornea becomes scared, and it have stopped the light from passing through the cornea to the retina, which the cornea appeared to be white or clouded over. However, this patient is classified as congenital corneal opacity because it had already present since this patient was birth. So as a result from that corneal opacity, this patient is experiencing a reduced vision for both distant and also near. So that's it for my part.
Okay, now I will discuss further about the visual aids that we choose in these cases. So, the patient is suitable to use the low vision aids to improve his vision, especially at near, because his visual demand now as a student is more on the near tasks. For example, reading, writing, and also doing homework. This visual aid is also expected to give him more satisfaction and is him to do near work because he has a close reading distance. So we have tried with 4 different low vision aids, and among all, we found out that the illuminated handheld magnifier is the best choice. The reason why is the patient felt more comfortable using it compared to the spectacle magnifier. Okay, one of the reason is with the spectacles magnifier, he have some difficulty and tends to search for the words because he has eccentric viewing. Another reason we prescribe illuminated handheld magnifier is it can give a brighter illumination
to the patient when he is reading or doing homework. So for these cases, we decided that the illuminated handheld magnifier is the best choice because it can be used at any distance for the patients, and it is suitable for the patient that has eccentric reading. So that's all from me. Thank you.